The Interventional Neurology program at Winchester Medical Center seeks to limit the impact of stroke on patients' lives. For ischemic stroke, we try to reperfuse patients to limit the size of their strokes, get them up, walking, talking, working with physical therapy, and back home, and ideally back to work or to previous activities as soon as possible. On average, patients have either difficulty moving, they're paralyzed on one side or the other, they may be unable to speak, or they may become unaware of their problem. With issues like this, it's impossible to come home or to go back to work. But with TPA, we were able to decrease the number of people who are permanently in a state like this by about 30%. With intervention, we decrease it by another 30 to 40%. For acute ischemic stroke, we're able to take over when TPA doesn't work or when a patient has a contraindication to TPA. We actually go inside the brain and either through a stent retriever construct or just by slacking the clot out, can remove a clot and open up a blood vessel to allow normal blood flow. Reperfusing the brain limits the amount of stroke and gives the patient the best chance for a good outcome. Often some of the major deficits that they have can be reversed right after the institution of treatment. So once blood returns to the brain, people start talking, walking. We've had a number of patients who came in paralyzed either on the left or the right side of the body. And after thrombectomy, they were able to be up and around, walking, talking, using their arms and legs, and participating in therapy the next day. These are folks that after these interventions went back to work or their usual level of activity. And it's very exciting to see them back in clinic doing what they usually would be doing months or days before the stroke, rather than still paralyzed, having trouble communicating with their families. What is new and what we're providing that's different is a chance for a stroke to be treated not just 4.5 hours after onset, but really at any time, usually in the first 24 hours after onset, if the brain is still capable of recovery. So I would encourage you to think of somebody that has a left MCA or right MCA syndrome. That is, they are paralyzed on the right side and unable to talk, or paralyzed on the left side and confused, as a potential candidate for stroke intervention anytime in the first day after stroke onset, and especially in the first 12 hours. What is key is your assistance in helping these patients get to our interventional suite as fast as possible, because now the stroke could possibly be reversed.